Hello everyone, my name is Dr. Michael Yankee, and today we're going to cover the human anatomy. Basically, we're going to do an introduction of the human anatomy, and then we'll also look at some divisions of the body. Okay, so basically, if you are new to anatomy, if you're a medical student or if you're an allied health student and this is your first time doing anatomy, this is one of the first lectures that you are likely to encounter: introduction to anatomy, and also divisions, looking at the nomenclatures and also looking at planes of the human body. Okay, so at the end of this presentation, I would expect that you would be able to define anatomy actually from the root word. You should be able to explain the importance of human anatomy. You should be able to discuss the history of human anatomy. You should be able to discuss the various divisions of human anatomy. Okay, so let's start. Introduction to anatomy. So anatomy actually comes from the root word. It's actually a Greek word which means anatomy. Anatomy means that cutting up. Okay, so you notice that usually when you go to the dissection room, there are cadavers. We make a lot of cuts just to study structures. So that's basically the root word of anatomy, just cutting up of body structures. That's anatomy basically. So anatomy simply means the study of the structure of body parts and their relationships to one another. Okay, so for instance, how the heart is connected to the brain, how the heart is connected to the liver, how the heart is connected to the spleen, how the heart is connected to the stomach. That's the relationship between structures, and it's by cutting all those structures up that you can really appreciate how they work together. Now we'll look at the importance of anatomy. Anatomy is arguably the bedrock of biomedical and medical sciences and the cornerstone of medicine, which I agree. I mean, the physiologists also tell you that their discipline is actually the bedrock. I don't agree with that. I actually think the anatomy is the bedrock of biomedical and medical sciences. Another importance is that it forms a basis for a systematic and intelligent approach to the examination of a patient. Another importance is that it is useful for recognition of pathological changes. Example is appendicitis. So for instance, we know where the appendix is. If you look at the quadrants of the abdomen, okay, we know that the appendix anatomically is found at the right iliac fossa. So if a patient comes to you and the person is complaining of right iliac fossa pain, okay, you know what particular structures are there, and you know that from your anatomy that is likely to be the appendix. Then you can make an educated guess and say, oh, it's likely to be an appendicitis. You can entertain that diagnosis. Okay, this is basically one of the importance of anatomy. Another importance of anatomy is that it forms a basis for an intelligent surgical management of the various disease conditions. So of course you cannot be a very good surgeon if your anatomy is on life support. Your anatomy has to be very, very good because it's the basis for an intelligent surgical management. The last thing is that it forms a basis for radiological diagnosis. Now, so we'll look at the historical review of anatomy. We are going to look at various individuals and their contribution to anatomy. We'll look at their works and anything they did as far as the study of anatomy is concerned. What you need to take from this part is that you don't necessarily have to choose the year they were born or the period in which they lived. You just need to know their names and perhaps their contribution to anatomy. Okay, so the development of anatomy is as a science dates way back to ancient Greece. Okay, you remember the capital of Greece, which is Athens, from 500 to 300 BC before Christ. So the first individual we're going to talk about is Almaxion of Croton. Alcmaeon of Croton. I don't know if I got the name right. Alcmaeon of Croton, 515 BC. Okay, what he actually did was he conducted dissections on animals, probably goats, Okay, and he was actually the first person to identify the brain as the seat of understanding and also to distinguish understanding from perception. That's what this individual did. He was also thought to indicate that the sensory organs were actually connected to the brain by channels. So when they refer to channels, they mean nerve cells, okay, or nerve fibers. And this man also discovered these nerve fibers connecting the eyes to the brain, okay, what we call the optic nerve, by excising the eyeball of an animal, although it is doubtful that he used dissection as a standard method. Okay, so this is what he did. So you can just note the name of the man. Don't need to learn the year, and just learn his contribution to anatomy. He was the first to identify the brain as a seat of understanding and also to distinguish understanding from perception. So Alcmaeon of Croton. Now, still in Athens, okay, Greece, we look at another man that most of us are familiar with, Hippocrates. Most of us are familiar with this man, Hippocrates, also known as the father of medicine. Okay, so what he did was he studied the brain of a goat, including its blood supply, and he was also the first to classify the human race according to physical characteristics. And he made very important observations on fetuses and the anatomy of the heart. Okay, so father of medicine, he studied the brain of a goat, including its blood supply. He classified the human race according to physical characteristics and also made observations on fetuses and the anatomy of the heart. The second individual we'll look at is Herophilus. So now we are moving from Greece to Egypt, where arguably is stated to be the place where civilization started. Okay, Herophilus, from 325 to 255 BC. He was the first to recognize the brain as the seat of intelligence and as the central organ of the nervous system. He also divided nerves into motor and sensory components. Now, he was the first to also make a dichotomy between the cerebrum and the cerebellum, which is found in the brain. Okay, distinguish between cerebrum and cerebellum. All right, Herophilus distinguished between cerebrum and cerebellum. He divided nerves into motor and sensory components and also recognized the brain as a seat of intelligence and as the central organ of the nervous system. Then we are moving to the Roman Empire. Galen. So if you start neuroanatomy, you're going to hear one popular vein, which is the great vein of Galen. And this vein was actually named after this man. Great vein of Galen was named after Galen. Okay, 129 to 199 AD. What he did was he studied and described the human skeleton and also classified joints. And he also was the first to give an accurate description of the form and functions of muscles. He also classified cranial nerves. Okay, we'll talk about that later, cranial nerves in neuroanatomy. And his theories on human anatomy dominated and also influenced medical sciences until the Renaissance period. All right. So just know a few things that he did. He classified the cranial nerves, he gave an accurate description of the form and functions of muscles, and he was also the first to study and describe the human skeleton and also classified joints. Then we move to modern times. Another interesting and wonderful man. He was actually a surgeon and also a Belgian anatomist by name Andreas Vesalius. He was the first to dissect human body, okay, and also gave lectures to a very large audience. So you can see this man with his beard, Andreas Vesalius. Still on Andreas Vesalius, he published a monograph titled On the Fabric of the Human Body and also highlighted more than 200 errors in Galen's theory. You remember Galen, great vein of Galen, okay, and also brought a paradigm shift to the study and teaching of anatomy. Then we move to Italy. There's a man by name Marcello Malpighi. He was an Italian anatomist and physiologist. And what he did was he was the first to use a microscope in the study of anatomy and also discovered the capillary system in 1661. And he led the study of microscopic structure of animals and tissues during the 17th century, Marcelo Malpighi. Then we move to Netherlands, the Dutch. There was a Dutch natural scientist by name Anton van Leeuwenhoek. In 1675, he developed the first of the 400 simple microscopes, and he used one to give the first accurate description of red corpuscles. Okay, Anton van Leeuwenhoek. Then we go to France, Marie-François Xavier. He was the first to use the word tissue, from French word tissu, which means to weave or texture, in the biological sense. He was an anatomist who pioneered histological study of organs. Okay, Marie-François Xavier. So when you remember histology, he was the pioneer of histological studies of organs, Marie-François Xavier. Then we come to Czech. This guy was a Czech physiologist by name Johannes Evangelista Purkinje. So if you know the anatomy of the heart, there's one part called the Purkinje fibers. Okay, it was named after him. And then what he did was he invented the microtome, and also created the world's first department of physiology at the University of Breslau in Prussia in 1839, and the world's first official physiology laboratory in 1842. Like I said earlier on, you don't need to know all these things, just know the name of the scientists or whoever made contributions to anatomy, and just know briefly what they did. Okay, then we'll come to the divisions of anatomy. The divisions of anatomy. Traditionally, anatomy can be classified or is studied as gross anatomy, microscopic anatomy, or what we call histology, the study of tissues, developmental anatomy, what we call embryology. Then we have neuroanatomy. So during your semester, there will be a combination of all these classifications of anatomy. So you do gross anatomy, you do a little bit of microscopic anatomy, you do developmental anatomy, then you do neuroanatomy. So we'll pick each one and we'll break them down. Also, I would like to mention that there are some specialized branches of anatomy. Pathological anatomy, which is the study of structural changes caused by diseases. We also have radiographic anatomy, which is the study of internal structures, which is visualized by X-ray. Then we look at molecular biology, which is the study of anatomical structures at the subcellular level. Okay, so the first one, the gross anatomy. Gross anatomy can further be divided into 3 regions. Okay, we have the regional, we have the systematic or systemic, then we have the surface anatomy. So regional gross anatomy. So regional anatomy simply is the study of structures located in various regions of the body. So you can have head and neck, you can have upper limb, you can have the thorax, you can have the abdomen, you can have the pelvis, you can have the perineum, and then you have the lower limbs. Okay, so listen to how I'm mentioning it. It's in the form of regions. So the first part is head and neck. So head and neck. Then you come down to your upper limb. Then you go to your thorax, where your heart is. Then you go to where your stomach is, and your small and large intestine, your abdomen. Then you come to your perineum, your pelvic area, then your lower limb. So that's regional gross anatomy. Then you can come to systemic anatomy, or you can say systematic. Systemic anatomy actually is the organization of the body into functional units. So there's the nervous system, there's the cardiovascular system, there's the respiratory system, there's the digestive system, there's the genitourinary system. Okay, so now you can distinguish between regional and then the systemic anatomy. Okay, then the surface anatomy is just the study of the internal structures as they relate to the overlying skin. This is not really important. Under the gross anatomy, what you need to know is the regional anatomy and the systemic anatomy. Regional and systemic. For the regional anatomy, I've just said that you divide the body into regions. So head and neck, upper limb, thorax, abdomen, pelvis or the perineum, then the lower limbs. Then for the systemic gross anatomy, you look at the nervous system, cardiovascular system, respiratory system, digestive system, genitourinary system. Okay, then you come to microscopic anatomy or histology, the study of tissues. So this is the study of cells. You study cells, you study tissues and organs by using a microscope. Okay, so the study of cells is actually called cytology, and the study of tissues is called histology. Study of cells, cytology. Study of tissues is histology. Okay, now there's another aspect called the neuroanatomy, where you study the nervous system, you study the brain, the spinal cord, and the peripheral nerves. Okay, so we're going to end here. This has been the introduction. Okay, we've looked at the historical perspective of anatomy. We've looked at the divisions of anatomy. Thank you very much for your time. Like, share, and subscribe to this YouTube channel. Thank you. I'll see you in the next video. Hello everyone. So today we'll be discussing anatomical nomenclature. And this topic is very crucial because in order to communicate effectively as a clinician, you need to be conversant with your anatomical nomenclature. And so we're going to discuss this briefly. So this is the anterior view or the front view of the human body. Okay, so you can see some terminologies that have been used. So head is referred to as cephalic in anatomy. Okay, neck is referred to as cervical. The armpit is referred to as axillary. Okay, I mean the arm is the common word that the layman is going to use, but anatomists will prefer, or clinicians will prefer to use the brachial. Okay, in front of the elbow is antecubital. Then the forearm is called the antebrachial. Then the wrist is called the carpal. Okay, where we have the carpal bones. Okay, fingers referred to as the digit or phalangeal or the phalanx. Okay, the foot is pedal. Okay, the leg is crural. Ankle is tarsal. Okay, the pelvis is around the pubic area. Hand is manus or manual. Groin is inguinal. Okay, navel is umbilical. Breast is mammillary. Breastbone is sternal. Okay, and what have you. So this is the posterior view, or this is the back view of this cartoon. Okay, you can see the base of the skull, which is referred to as occipital. Okay, the shoulder is referred to as the acromial, okay, or acromion. Then the shoulder blade is referred to as the scapula. The spinal column referred to as the vertebral. Okay, back of the elbow, olecranon. Okay, the in between the hips we have the sacral region. Buttocks is called the gluteal region. Okay, popliteal is behind the knee. Calf is called sural. Then the sole of the foot is called the plantar. Okay, so these are various terms that anatomists usually use, and when you are communicating with maybe your consultant or your specialist, these are some of the terms that you need to use in describing an x-ray or a CT scan or an MRI. So we'll look at some anatomical directional terms. Okay, we'll look at the medial versus lateral. So we'll pick the anatomical body in the anatomical position, and we'll look at what is medial, what is lateral. We'll look at superior, we'll look at inferior with examples. We'll look at anterior, we'll look at posterior, we'll look at proximal versus distal. We'll look at superficial versus deep. Then we'll look at unilateral versus bilateral. We'll look at ipsilateral versus contralateral. Okay, so this is something that you need to know. Okay, as far as anatomy is concerned, you need to know this, and you're going to carry this for the rest of your life. It's called the anatomical position. Anatomical position. Okay, this is what the anatomical position says, that you should be standing upright. Okay, so we can see in this cartoon this man is standing upright. See, the head and the eyes are directed straight ahead. Okay, straight ahead, the head and the eyes, so they are not turned to the side, turned to the left or turned to the right. It's in the neutral position. Then the upper limbs are the sides, so you can see this is the upper limb. Both of the upper limbs are on the side, not that one is on the shoulder or the other is on the shoulder or behind your back. It's close to your sides or at your sides. Then the upper limbs slightly away from the trunk. So see, the limbs are slightly away from this is the trunk. Okay, this whole place is the trunk. Your upper limb is slightly away from the trunk. So you see there's this angle. There's this angle. So because it's away from the trunk, it creates an angle. Then the palms are facing forwards. So this is a palm. This is a palm is facing forwards. Not that the palm is facing backwards. The palm is facing forwards. Okay, and the thumbs are pointing away from the body. So this is the thumb. It's pointing away from this whole body. The thumb is away from this whole body. The lower limbs are parallel. Okay, so these are parallel. Okay, one here, the other here. Then the feet flat on the ground and facing forward. So you can see the feet is flat on the ground. Right, so this is the anatomical position. Again, for the anatomical position, you're standing upright. Once you're standing upright, your upper limbs slightly away from the trunk. This is the trunk. Upper limbs slightly away from the trunk such that it creates an angle. This one is away from the trunk. Okay, the upper limbs are also on the sides, not behind your back. They're on the sides. The palm is facing forwards. The thumb is away from the body. Okay, the lower limbs are parallel to each other, and then the feet is flat on the ground. So this is the anatomical position. So we'll look at some anatomical directions. Okay, we'll look at superior versus inferior. We'll look at anterior versus posterior. We'll look at dorsal versus ventral. We'll look at proximal versus distal. Then we'll look at medial versus lateral. All right. So all these are anatomical directions that we're going to look at. So this is the first one. We'll look at medial versus lateral, or medial and lateral. Okay. So whenever you are describing medial and lateral, once again, you can see that this cartoon is in the anatomical position. Okay, the cartoon is standing upright. The face is in the neutral position. The head and the eyes are in the neutral position, not towards one side. You can see that the lower limbs are away from the trunk, away from the body. Okay, it's creating an angle. The thumbs are away from the body. The palm is facing forwards. Okay, the lower limbs are parallel to each other, and then the feet is flat on the ground. Okay, now in describing medial and lateral positions, we need a reference point. Now your reference point is this imaginary line, okay, or this midline, which divides the body into two equal halves. Okay, now any structure that is towards the midline is medial. So you can see the red arrow is moving towards this direction. So any structure which is more towards the midline, this blue structure here, this blue line here, is medial. Now any structure away from the midline is lateral. Okay, so any structure towards the midline is medial. Any structure away from the midline is lateral. Okay, so we're going to look at examples. Okay, again, this cartoon is in anatomical position, head facing forward. Okay, eyes in a neutral position, lower limbs away from the body, thumb away from the body. The upper limb is slightly away from the trunk, thumbs away from the body, lower limbs okay close to each other, okay, and then the feet is flat on the ground. Now I said that for medial structures, the medial structure is when it is towards this imaginary midline. Okay, once it's more towards this midline, then it's medial. Once it's away from the midline, then it's lateral. Okay, so we'll look at some few examples. So in describing medial and lateral, we can look at this region. So this is the lungs. These two structures are the lungs, and in the middle is the heart. Okay, so we say the lungs are lateral to the heart. So because the lung is more away from the midline, so we say you can draw a midline. Okay, because the heart is more in the midline, so the heart is medial to the lungs. But because the lung is a bit away from the midline, then the lungs are lateral to the heart. Okay, so again we said that the reference is the midline. So the structure in the midline is the heart. So we are comparing the heart and the lungs. Okay, so in comparing the heart and the heart is more towards the midline than the lungs. The lungs is more away from the midline than the heart. And so in describing it, you say the lungs are lateral to the heart, whilst the heart is medial to the lungs. Okay. Then another example, we can use the eyes and the nose. Okay, you can see that the nose, so if we are drawing an imaginary line, this is the midline here. Okay, this is the midline, this is our reference line. You notice that the nose is just in the midline. Okay, so that is more close to the midline than the eyes. So in describing or comparing the eyes and the nose, we see that the nose, okay, we say the nose is medial to the eye. Then we say the eye is lateral to the nose because the eye is more away from the midline, right? Then we'll look at another directional term. We'll look at superior and inferior. Superior and inferior. Okay, superior means that anything above. So now here, you see, still in the anatomical position here, the reference point is the head. So any structure that is moving towards the head, or any structure that is more towards the head, is superior. Okay, any structure that is more away from the head is inferior. Okay, so superior means anything above, inferior means anything below. Okay, as simple as that. So we'll look at some few examples to appreciate what we are saying. So we are still comparing the eye and the nose. The eye and the nose. Here we said that superior means that anything that is more close to the head. Inferior means that anything that is more away from the head. So in comparing the eye and the nose, the eye is more towards the head than the nose. So we say the nose is superior to the eye, but the nose is inferior to the eye because the nose is more further, or is away from the head. So the eye is superior to the nose, and the nose is inferior to the eye. Okay, so this is another example, still talking about superior and inferior. We will use the heart and the liver as an example. So we are comparing the heart and the liver. We notice that the heart is more towards the head, or is above, more above than the liver. So we say the heart is superior to the liver, and the liver is inferior to the heart. The heart is superior to the liver is inferior to the heart. Very simple. Then we'll look at anterior and posterior anatomical directional terms. Okay, anterior and posterior. Anterior simply means that is the front side, or the front view, okay, towards the front of the body. So anterior part is the front view. Anterior is also known as ventral. Anterior is also known as ventral. Okay, so towards the front, or the frontal view, is usually called anterior. The back view is usually called posterior. Posterior is also called dorsal. Posterior is also called dorsal. Right? So then again, we'll look at examples. So the frontal lobe is anterior to the occipital lobe. So this is the brain. Okay, these are the lobes: frontal lobe, parietal lobe, temporal lobe, and this lobe here is called the occipital lobe. This is the occipital lobe. This is the cerebellum. This is the occipital lobe. So we are comparing this lobe and this lobe, this lobe and this lobe. Okay, this is the face. So you can see that this lobe is more close to the face, and the face is the front part of the body. And so we say the frontal lobe is anterior to the occipital lobe. You can see that this is towards the back. So we say the occipital lobe is posterior to the frontal lobe. As simple as that. Okay, frontal lobe is anterior to the occipital lobe. Occipital lobe is posterior to the frontal lobe. Then we'll look at another directional term. We'll look at proximal and distal. Proximal and distal. Okay, proximal means that it is towards the trunk. So this is the trunk, or your torso. This is your trunk, or near the origin. Okay, so proximal simply means proximity. Okay. Then distal means it is away. So distal means like a distance. When we say distal, it's more like a distance. You are so distant. That's where the word comes from, distal. So you are away from the trunk. Okay, you are far away from the origin. So some few examples. So we'll look at the wrist. We'll compare the wrist and the hand. So this is the wrist and the hand. Okay, we notice that in comparing the wrist and the hand, we notice that the one that is farthest away, okay, is the hand. So in comparing the wrist and the hand, we say that the wrist, okay, the wrist is proximal to the hand, because this is the hand is farthest away, and then the wrist is more close relatively. Okay, so we say that the wrist is proximal to the hand, but the hand is distal to the wrist. The hand is distal to the wrist, but the wrist is proximal to the hand. Then we can compare the elbow and the wrist. Okay, so this is the wrist, this is the elbow. In comparing the wrist and the elbow, we see that the wrist is further away from the elbow. The wrist is further away from the elbow. So we say that the elbow is proximal to the wrist. Okay, and the wrist is distal to the elbow. But when we're comparing the wrist and the hand, we said that the wrist is proximal to the hand, and the hand was distal to the wrist. But now we are comparing the wrist and the elbow. Okay, and we notice that the elbow is more closer to the trunk, which is this side. So because this is more closer to the trunk, then we say this is more proximal. So in comparing the elbow and the wrist, we say that the elbow is proximal to the wrist. All right, then this is the elbow, this is the shoulder. Okay, this is elbow, this is shoulder. The shoulder is more close to the trunk here, so the shoulder is more proximal than the elbow. So we say that the shoulder is proximal to the elbow and the elbow is distal to the shoulder. Okay, so the same thing here, the ankle is proximal to the foot. Okay, so this is the ankle, this is the foot. The ankle is proximal to the foot because that's more closest to the trunk. So the ankle is proximal to the foot. The same way the knee is proximal to the ankle, the same way the hip is proximal to the knee. Alright. Then we use another term, superficial and deep. Superficial and deep. We can say superficialis or profundus. Okay? Now, when we say superficial, it means that it is closer to the surface of the body. So here, the surface of the body is actually the reference point, or your skin. Okay, your skin or the surface of the body. Okay, any structure that is closer to the surface of the body is superficial. All right. So we'll use examples to help us appreciate what we are saying. So when we are comparing the skin and the ribs, we know that we encounter the skin before the ribs, and the skin is more superficial, okay, to the ribs. You need to go deep before you encounter the ribs. Okay, so in comparing the skin and the ribs, the skin is superficial to the ribs. However, if we are comparing the ribs and the lungs, okay, once you go through the skin, you encounter the ribs before you encounter the lungs. Okay, so we notice that the skin is more closer to the surface than the lungs, and so the ribs are superficial to the lungs. Okay, the ribs is more closer to the superficial to the surface of the body than the lungs, and so we say the ribs are superficial to the lungs. All right. Now, in using the word deep, okay, let's compare lungs and then tissue and then ribs, because the ribs is superficial to to the lungs. The reverse is true. The lungs are deep to the ribs. Okay, then the ribs are deep to the skin. It's as simple as that. It's as simple as that. Okay, again, the skin is superficial to the ribs because you encounter the skin before you encounter the ribs. The skin is closer to the surface of the body. Now, in comparing the ribs and then the lungs, okay, the ribs are more closer to the superficial surface than the lungs. Now, in using the term deep, the lungs is more deep than the ribs, okay, because the ribs is more closer to the surface of the body. Now we're going to use another term, unilateral and bilateral. Unilateral and bilateral. Uni means one, bi means two. Okay, so unilateral means that maybe there's an involvement of one side of your body. Okay, so usually for patients who have stroke, you notice that they can't move their upper limb, they can't move their lower limb. So this side, one side of the body is affected. So we say it is unilateral involvement. Okay. However, there are times when both the right and then the left side of the body will be affected. And now you can say there's bilateral involvement. Okay. It's involving both sides of the body. So the right side and then the left side. Now, another term, ipsilateral and then contralateral. It's a bit confusing, but it's very easy to understand. Ipsilateral and then contralateral. So, for example, if a patient has a brain tumor, okay, and the right part of the brain, and then there's weakness on the right side, then you say that because the tumor is on the right, because the tumor is on the left side of the brain, and then the weakness is on the right, then you say that there's contralateral weakness. There's contralateral weakness, because sometimes you expect that because the tumor is in the left side of the brain, then of course the weakness should be in the left side, but no, the weakness can be on the right side, and if it's on the right side, you say there's contralateral involvement. However, if the tumor is in the left brain and then the weakness is on the left side, which is the same side of where the tumor is, then you say it is ipsilateral. So ipsilateral means that on the same side of the body. Contralateral means that on opposite sides of the body. Okay, so we'll look at some few planes. Very important. this one too can be a bit confusing. Okay, so when you cut, so this is the brain. When you cut the brain, okay, across, okay, this is the transverse view. It's going trans, it's going through the brain. Okay, this is a transverse view. Now this is a frontal view. Okay, frontal view. So look at how the plane is going. Frontal view. The frontal view or the frontal plane is also called the coronal plane. Coronal plane. Then we have the mid sagittal plane. Okay, so sagittal plane, mid sagittal plane means that it divides the body into two equal halves. Okay, so this is the cartoon. You see this plane dividing, going this way, dividing the woman into two equal halves. This is the mid sagittal plane. Now the one going across her abdomen, okay, or below the umbilicus is the transverse view. Okay, then you can have one going this way, going this way. This is the frontal view or the coronal view. Okay, so you can have mid sagittal or parasagittal. The difference is that for mid sagittal it divides the body into two equal halves, but for parasagittal it divides the body into two unequal halves. Okay, so if you have the sagittal plane has two angles or two subtypes. You can have the mid sagittal and then parasagittal. Mid sagittal means that it divides the body into two equal halves, but parasagittal means that it divides the body into two unequal halves. Right? So there's another view here for you to appreciate. So going this way is mid sagittal. Okay, going this way is the frontal or the coronal. Then across is the transverse. Alright? So these are fixed lines of reference along which the body is often divided or sectioned to facilitate viewing of its structures. Okay, allow one to obtain a three-dimensional perspective by studying the body from different views. Right? Now these are other positions that you need to learn, you need to appreciate. Okay, this is the prone position. So if you are lying facing downwards, okay, such that your back is facing the sky or your back is towards the sky, then that's, we call it a prone position. Prone position. Okay, this is the supine position. If you are lying in such a way that your abdomen is towards the sky, okay, or is facing upwards, this is the supine position. Okay, then we've spoken about the unilateral and then bilateral um, directional terms. We've spoken about that. Say unilateral if it involves one side of the body, bilateral if it involves both sides of the body. Okay, so this is actually a scan. Okay, this is an MRI scan, magnetic resonance imaging of the brain. Okay, and it is telling you the view. Okay, so when you take various views using the MRI, okay, when you take the frontal or the coronal view, this is the frontal view, the coronal view, this is how you see it on the MRI scan. Okay, so this is the frontal view, this is the coronal view, this is how you see it on the MRI scan. So it's going towards this way, okay, across the ears, right? Now if you the plane goes in such a way that it divides the body directly into two equal halves, which we refer to as the mid sagittal, or sometimes some people call it mid sagittal. Okay, on MRI this is how it will look like. Okay, this is how it looks like. Okay, so the plane dividing the body into right and then left portions. Mid sagittal or median are names for plane dividing the body into two equal halves. Okay, so right and left. Then we have another plane, which is the transverse plane, okay, going towards this direction, towards the abdomen, okay, across the abdomen, sorry. The horizontal plane dividing the body into upper and lower portions, okay, also called the horizontal plane. So this is still an MRI of the brain. This is how it will look like, okay. So this is just the definition. Three-dimensional structures. Transverse plane divides the body into superior and inferior sections. Frontal plane or the coronal section or the coronal plane, it divides the body into anterior and then the posterior section. Then the sagittal plane divides the body into left and right sections. Okay, I said so when the plane divides the body into exactly two equal halves, that's mid sagittal. But parasagittal is when it divides the body into two unequal halves. Okay. So we'll look at some movements, okay, and how you describe it anatomically. Okay, so this is pronation. Okay, turning the arm or foot downwards. Okay, so this is that when you turn the hand in such a way that this is the final position you have. You see that you are seeing the back of the hand. Okay, the back of the hand. This is pronation. Okay, the act of turning the hand in such a way that the front part becomes the back part. It's called pronation. So you turn the arm or the foot, okay, downwards. So this one is going downwards to have this, to assume this position. It's called pronation. Okay, the reverse is called supination. Okay, when you turn, so this is a pronated arm or pronated hand. If you turn this hand upwards such that your palm is facing upwards, then it is supination. Another movement you need to know is flexion and then extension and then hyperextension. Flexion is when you bend a joint or you are decreasing the angle between two bones. So you can see, okay, if your hand is neutral, okay, so this like if your hand is straighten just like 180 degrees. Once you bend it, you reduce the 180 to like about 90 degrees. So this flexion. So this position, okay, is a flex position. This position is a flex position. Okay, when he returns his arm to the back to that position, okay, so this is a flex position. When he straightens his arm again, then it means he's extending such that he is increasing the angle between the two bones. So straightening a joint or increasing the angle between two bones, okay, is extension. All right, then hyperextension, excessive extension of the parts at a joint beyond the anatomical position. Okay, so one of the questions they can ask you in your MCQ, in the anatomical position, the arms are actually extended, not flexed. True or false? Okay, you should know that in the anatomical position, okay, the arms are actually extended, not flexed. All right. So these are various movements: flexion, extension, hyperextension, adduction. Adduction means that you are moving your arm towards your trunk, or you are moving your arm towards the midline. Okay. Abduction means that you are moving your arm away from the midline. Okay. We've spoken about pronation, spoken about supination, retraction, pronation, all these ones. Um, just try and read on it. Okay. So thank you very much for your time. Kindly like, share, and subscribe to this YouTube channel. I'll see you in the next video. Bye bye.